Okay, so I do apologize for how I look right now. I have COVID. Um, okay, so seniors health physical activity tips. So physical activity is extremely important in the everyday lives of all human beings of any sort of age. Being physically active can improve a number of things. This being, it helps with weight management, improves your heart health overall, um, helps improve muscle strength and balance, and can help increase your lifespan overall. Including physical activity into your daily life will not only improve your physical health, but it also helps improve mental health. So, seniors' health and physical activity. It is said that the loss of stamina and strength that comes with aging is partly due to just having reduced physical activity. Inactivity increases with age, according to the Centers for Disease Control and Prevention. Around the age of 75, about 1 in 2 women and 1 in 3 men will not engage in any physical activity whatsoever. Being physically active is extremely important for older adults, and it can improve many things, which includes one's ability to live independently and by themselves so they don't have to be in homes, reduce falling risks and bone fractures, reduces the risk of developing coronary heart disease and diabetes, as well as many other things. Reduces the risk of developing high blood pressure and can reduce blood pressure in people who already have hypertension. It also improves symptoms of depression and anxiety. Some activity tips, some tips to start including physical activity in your daily life could be trying to find an activity you will enjoy doing. So cycling or going for walks, this will make it a lot easier to want to partake in the activity and not make it seem like such a task. Start slow and then gradually build up over time. So increasing your activity time by 10 minutes each time when you feel you're ready to do so. Looking for group activities to attend with others could also benefit because you could include some social time in there and make it more fun. Try taking the stairs rather than the elevator or walk wherever and whenever you can. So just trying to get that extra physical activity wherever you can. Including both aerobic and strengthening activities is a good tip as well. And lastly, listen to your body 100% and don't try to push yourself anymore. So aerobic activity, it consists of continuous movement that will get your heart rate up and your breathing rate as well. Older adults should try for about 2.5 hours of moderate to vigorous aerobic activity every week. Moderate aerobic activity will increase your heart rate and breathing rate, but not so much that you aren't able to talk through it. So cycling or going for a swim. Vigorous aerobic activity does make your heart rate increase and breathing increase quite a bit, and you should have to catch your breath before you are able to say anything. So like jogging or taking a hike. Try to spread these activities out into multiple sessions of 10 minutes or more because you don't want to burn yourself out too quickly. Strengthening activities. These will help grow your muscles and bone strength and help reduce fall risks and fractures. Fractures that can occur during the aging process. You should do strengthening activities at least twice a week. These activities can help your posture and balance. There are 2 types of strengthening activities. Muscle strengthening, which activates, or activities that will build your muscles up. Some of these examples are lifting weights, climbing stairs, or even if you're out gardening, the action of digging in the soil can be an example of muscle strengthening. Bone strengthening. These are activities that make your muscles pull and push against your bones to help make them stronger. Some of these examples are running, walking, or participating in yoga. Safety. So some of these activities could possibly be dangerous for some depending on their overall health and physical abilities. These are recommended levels of activity applying to any adult age 65 and older and don't have any diagnosed or suspected medical conditions. If you're not sure about the type of amount of activity that is recommended, it's best to talk to a healthcare professional about what might be the most appropriate for you. Remember, don't push yourself. Physical activity will not have any benefit if you do end up hurting yourself in the process. Below we have a Canadian Physical Activity Guideline article. This was created by the Canadian Society for Exercise Physiology. And I can open this really quick. So it's just a basic 24-hour movement guideline for older adults age 65 and older. And below, it'll show you the guidelines. So I will close out of this, get back to here. So this will just be a short summary of what is mentioned in the Canadian Physical Activity Guideline that I just showed. There are 3 very important factors that play in everyone's life, and this is what a healthy 24 hours may look like. So physical activity is number 1, doing moderate to vigorous activity for 150 minutes per week. Muscle strengthening activities that will challenge balance, multiple hours of light activities. So what I have talked about before earlier, roughly. Sleep is another big important one. So trying to get at least 7 to 8 hours of sleep regularly will help improve a lot of things. And try to keep your wake up times and bedtimes consistent. And then sedentary behavior, limit sedentary time to 8 hours or less. Screen time should be reduced to no more than 3 hours per day. And try to break up long periods of sitting, so getting up and walking around for a few minutes every hour. Personal health practices and coping skills. So one of the 12 social determinants of health is personal health practices and coping skills. This key determinant refers to the actions performed by individuals which can help prevent disease and encourage self-care. So it can also help an individual cope with challenges and develop the ability to rely on themselves, improve their problem-solving skills, and make healthy choices that can improve their overall health. Early in the first years of life, we develop coping skills. These skills are very important in supporting a healthy lifestyle. Coping skills are what people use to be able to effectively interact with others and the world around them on a daily basis, as well as challenges and stress that they may face on a daily basis. Having good coping skills helps a person make sound decisions and reduce their chances of turning towards unhealthy choices, such as alcoholism, drugs, those sort of things. So having both personal health practices and coping skills in your everyday life helps improve many things. It helps one avoid drug and or alcohol abuse. It improves mental health drastically and helps people face the challenges that life can bring in positive ways rather than negative. As we mentioned before, including physical activity into everyday life is very beneficial. But engaging in physical activities can also be used as a coping skill for whatever that person may be facing. So physical activity does help reduce anxiety and depression symptoms. It also improves the person's self-esteem and confidence in themselves, and it also helps with cognitive function. So what is the goal? The main goal of this health promotion is to improve and maintain the ability to care for oneself. So improve and maintain the ability for an older adult to care for themselves. It's to help protect and enhance the quality of life of the world's older adult population. Exercise helps build muscle and bone, and this helps reduce the risk of accidental falls and injuries. It also helps older adults become more confident in themselves and their ability to live independently without help. And here are my references.